8 years later, and this Tuesday, the government says it's all systems go to birth a new era in the health sector. Out goes the National Health Insurance Fund, NHIF, and in comes the Social Health Insurance Fund under the Social Health Authority as of midnight tonight. Proponents of the new insurance scheme are lauding it and saying that it will serve as a game changer in enabling Kenya achieve the universal health coverage dream, unlike NHIF. Now, as our reporter Moige William now tells us, SHIF, among other benefits, is set to introduce new services not covered under NHIF, such as screening for common health conditions and cancer. Let's take a look.
In just a few hours, the 1966 Act of Parliament that established the National Health Insurance Fund, NHIF, will vanish from Kenya's health landscape. After 58 years, the fund, which supported 17 million Kenyans, will be replaced by the newly introduced Social Health Insurance Fund, SHIF.
Healthcare services under the Social Health Insurance Fund will be accessible upon registration and contribution. And equally, as we have said, NHIF will not stop.
Scheduled to come into operation by Tuesday, 1st of October 2024, the Social Health Insurance Fund, SHIF, under the Social Health Authority, SHA, Kenyans will access primary health services and emergency treatment simply by registering as a member, where unlike NHIF, there will be no requirement to have up-to-date payments to access outpatient services. NHIF's coverage was more limited, especially for people with chronic conditions.
All Kenyans will access emergency medical treatment, which includes 24-hour stabilization, notwithstanding the registration status.
Also, SHIF has been highlighted as a plus in providing affordable health care to every Kenyan for maternal care, where unlike under NHIF, delivery costs for expectant mothers were covered as long as their membership was up to date. Through full membership in SHIF, coverage for all deliveries is guaranteed.
When you think of the vulnerable, the needy in the society who are unable to access health, I think it is one challenge that we need to take as a Ministry of Health so that we can support them.
Among the myriad of services lauded as a game changer in offering health services, the new module further will introduce new services not covered under NHIF, such as screening for common health conditions and cancers, covering the cost of consultation, preventive and restorative treatments like extractions and scaling, as well as resuscitation and stabilization for critical conditions. According to the government, the new system aims to provide better health services for all Kenyans, addressing the limitations of the NHIF and expanding the scope of care to include preventive and chronic illness management. Moige William, TV 47.